I typically perform these procedures all in one surgery. So, but it takes a bit of planning. I take a CT scan on all my patients when I'm preparing for this type of surgery, and I will sit with the CT scan, and I have a special program to select implants and where I want these implants to go. So I have a real good idea as to the anatomy and the type of implants that I'm going to use and where I'm going to go with my implants. So the patient will typically come in on a half day, and we will sedate the patient for comfort, numb the area, and gently remove the roots of the teeth and the teeth themselves, clean out whatever infections we may have, place our implants where we planned on placing them, and I would have a lab person here so that we can make the teeth that same day and deliver. And so the patient leaves with a set of teeth day of.